A tubal pregnancy happens when a fertilized egg, instead of implanting in the uterus, implants in the fallopian tube. The fallopian tubes are narrow tubes connecting the ovaries to the uterus. This is also known as an ectopic pregnancy. In a normal pregnancy, the fertilized egg travels down the fallopian tube and implants in the uterus. However, in a tubal pregnancy, the egg gets stuck. The fallopian tube isn't designed to hold a growing embryo. As the pregnancy develops, it can cause the tube to rupture, leading to serious complications. Early signs of a tubal pregnancy can be subtle and easily mistaken for other conditions. This is why it's crucial to be aware of any changes in your body, especially if you're pregnant or think you might be. One of the first signs is a missed period, which is also a common symptom of a normal pregnancy. You might experience breast tenderness and fatigue, again similar to early pregnancy symptoms. However, pay close attention to any unusual pain. You might feel a dull ache or sharp pain on one side of your lower abdomen. This pain might come and go or be constant. Don't ignore any unusual vaginal bleeding or spotting. It might be light and irregular or heavier than usual. Remember, early detection is vital. If you suspect anything, contact your doctor immediately. As the tubal pregnancy grows, the symptoms become more severe and noticeable. The pain in your lower abdomen may intensify and become sharper. You might feel a stabbing pain, particularly when you move, cough, or sneeze. The bleeding might also increase and become heavier. It might be bright red or dark brown, and you might pass small blood clots. Some women experience shoulder tip pain. This is a referred pain caused by internal bleeding irritating your diaphragm. Other symptoms to watch out for include dizziness, lightheadedness, and fainting. These can be signs of internal bleeding and require immediate medical attention. If you experience severe pain, heavy bleeding, or any signs of shock, call your local emergency services immediately. Section 4. Serious risks. Understanding the consequences. A tubal pregnancy is a serious condition that can have life-threatening consequences if left untreated. As the pregnancy grows in the fallopian tube, it stretches the tube beyond its capacity. This can cause the tube to rupture, leading to internal bleeding. Internal bleeding can be very dangerous and, in some cases, fatal. It can lead to a drop in blood pressure, shock, and organ damage. If a fallopian tube ruptures, it can also damage the other tube, affecting future fertility. Even if the tube doesn't rupture, a tubal pregnancy can cause scarring and blockages in the fallopian tubes. This can increase the risk of ectopic pregnancy in the future and lead to infertility. It's crucial to understand the potential risks and seek immediate medical attention if you suspect a tubal pregnancy. Section 5. Seeking help. Treatment options. If a tubal pregnancy is diagnosed early, treatment options can prevent serious complications. Your doctor will discuss the best course of treatment based on your individual circumstances. One option is medication. This involves injecting a medicine that stops the growth of the pregnancy. This allows your body to absorb the pregnancy tissue naturally. Another option is surgery. A laparoscopic procedure is usually performed, which involves making small incisions in your abdomen. The surgeon can then remove the pregnancy tissue from the fallopian tube. In some cases, if the tube is severely damaged, it might need to be removed. Section 6. You're not alone. Finding support. Experiencing a tubal pregnancy can be emotionally challenging. It's important to remember that you're not alone and support is available. Talk to your doctor about your concerns and ask any questions you might have. They can provide you with resources and connect you with support groups. Sharing your experience with others who understand what you're going through can be incredibly helpful. Remember to take care of your mental health during this time. Practice self-care, engage in activities you enjoy, and allow yourself to grieve the loss of the pregnancy. Surround yourself with loved ones who can offer emotional support. Don't hesitate to seek professional help from a therapist or counselor if you need it. Section 7. Remember, early detection is key. Tubal pregnancies are serious but treatable. Early detection is crucial for preventing life-threatening complications. Be aware of the early signs and symptoms, such as abdominal pain, vaginal bleeding, and shoulder tip pain. Don't ignore any unusual changes in your body, especially if you're pregnant or think you might be. If you experience any of these symptoms, seek immediate medical attention. Remember, knowing the signs and acting quickly can make a significant difference. Your health and well-being are paramount. Don't hesitate to reach out for help and support when you need it most.